Let's get going. All right, so thank you guys for joining me today. Today we're going to talk about how to prevent cancellations and dropouts during this newest surge. And for those of you that have been on one of my previous webinars this month, it truly is a problem for all of us. I was just talking to Brittany, whose team was one of my clients last year, and the reality is this: the only thing we can't prevent is an act of God. And the reality is we can even control that situation as well. So for those of you on the East Coast, like my practice, you're probably dealing with some bad weather. Well, guess what? We can't prevent an act of God. We can't prevent COVID from infecting our patients as much as we would like to. We can protect them as best we can in our practice, but we can't prevent it. And we can't prevent snow and ice, but we can do something about it. Okay, and so I'm going to really talk a little bit more about that today and help you guys. So we're going to talk about how to prevent cancellations and dropouts during this newest surge. And we're going to talk about helping our patients get the care they need and deserve as we move forward. Now, for those of you that are just hopping on, I just want to let you know, this isn't a sales webinar. You will get good content out of this. If you want me to share it with you when we're done the recording, please just drop your name and email in here. I'm not going to send it to everybody that signed up. I'm only going to send it to those of you that attended today. All right, so let's get going. So the first thing that we all have to talk about here is it's important that we all remain focused on our purpose and our product, okay, even in uncertain times. So when we have bad weather, when we have a surge in cases, it creates a lot of uncertainty for all of us. And it's important that we maintain our focus and keep our purpose and our product in mind as practice owners and managers, and keep our team focused on this as well. Our purpose and what we produce as a practice are one and the same. They are not different. It's people helped. If I asked any one of you why you got into healthcare, if you walked up to the practice owner, if you walked up to anybody in your practice and you asked them while they're working there, I would hope that they would all say to help people, right? So what we produce as practice, our main product is people helped. If you're a physical therapy practice, you know that your ultimate product, your end product, is a patient who has fully completed care, achieved all of their goals, and is willing to tell others about us. Well, guess what? That's somebody that we helped. The metrics and stats that we track and measure in every single department represent how we help people. So if you're looking at as a practice that we help people, whether you're looking at arrival rate, right? Arrival rate percentage is just simply a measurement of how well we helped our patients understand that they need to show up for care. As a practice as a whole, if you're looking at patient visits, it's truly a measurement of people helped. So I have a question for you. Are you helping someone if you let them cancel or drop out for any reason? Look, this is a big button for all of us right now. We have a lot of patients that are either canceling all of their visits, canceling a good portion of their visits, or dropping out because of COVID, whether they get COVID, whether they're exposed to COVID, or maybe they're just in fear right now. Right now, we're battling two specific things. We're battling illness, right? A rise or a spike in cases. And we're battling fear or confusion. And there's a lot of confusion out there as well. Now, illness is pretty basic, but when it comes to any infectious disease, right? Take COVID out of the game. When prior to 2020, I did not want illness coming in my practice, right? So I didn't want it there. Doesn't matter if it's COVID, if it's the flu, if it's a stomach bug, we don't want it. But here's the other thing, people are uncertain. They don't know what to do about quarantine and isolation. They don't know how long. They don't know what to do when. They don't know whether they should get tested or not tested based on their symptoms or anything else. Then there's fear. You're not just battling COVID anymore, right? If you noticed in 2021, things seemed to like they settled down, but something happened with this new surge in cases with this Omicron variant. And now we're back to what it felt like in 2020. And maybe this is real to some of you. So the fear is also very real. You're battling people's fear. And I don't mean that in a bad way, but we have to understand it in order to help our staff and our patients through it. People are scared. Okay, so I want to show you something. I'm going to go through it kind of quickly because this is what your staff and your patients are seeing. That's a lot, right? Well, what does this do? It creates confusion and fear for all of us. So how do we help reassure our team and our patients? Now, one thing I want you to understand about this screen, about 2 weeks ago when I started these webinars, I went on to Facebook during my lunch hour, which very many of our staff and our patients do, and I scrolled through Facebook. And I went on to Facebook News and I started scrolling, and these are all the articles that popped up in that 5-minute scroll through Facebook. Now, the other thing you need to understand is many articles in the news anymore are not news. They're opinion-based. So if you look at the one that's kind of front and center where the woman's holding the mask and you can see the headline, it says NBC News suggests children should wear 2 masks to prevent COVID. You want to layer. What I want you to understand is this creates a lot of confusion out there, okay? This is opinion, right? It's somebody's opinion, but there's no set consistency on this. So I want you to understand that as an owner or manager, your team needs you. They need you to be the stable base for them, okay? If you don't create stability, you're going to have a lot of difficulty as a team, as a practice. So how do you do that? Well, the first thing you have to do, if you were on several weeks ago, you know that I said you need to be the voice of reason. At all times, you are the voice of reason. They need you to lead them. They need you to guide them. Your job as a leader is to weed through the confusion that's out there, to maintain a clear mind, to keep everyone on the right path. Your main responsibility as an owner or manager is to get others to get things done. That's our job as a leader, as somebody who is going to be a good leader. Your job is to help your team to be able to get things done, to be successful, as we talked about in the first several slides, at helping people. You have to be able to give your team the tools they need to be successful. So this is you. You're the leader. So ask yourself, does my team have the tools they need to succeed? Are you supplying your front office, your clinical team, your billing team? Are you supplying your entire team with the tools they need to be successful? Now, I want you to consider for a moment where the average person, right, where most people get their information. They get it from watching or reading the news or from social media. So you need to be aware of what your patients and staff could be seeing every day. If you're not doing a quick screen grab or a quick scroll through Facebook or their news feed or this average news feed, right? If you're not doing that, you don't know what they could be seeing or hearing, and you can't be prepared to help your team or your patients through this. And you have to be prepared to handle it. Now, if you're like me, you're sick of hearing about COVID. You're so tired of it. It's wearing, right? It just wears us out. But as leaders, if we want to be true leaders for our team, we cannot get so sucked into the day-to-day or into patient care that we're not taking care of our family. And I'm going to talk about that in a minute. So they need you to be their protector. Right? As a leader, we do protect the team, we protect the family. And if you're like me, I was just at a conference this past weekend with physical therapists and veterinary practices, and we were having a discussion. And I was like, well, how many of you see yourselves as a family-owned practice, right? Where this is, and when you hire people, you're like, welcome to my family, right? Part of welcoming someone into your family is you have to protect the family. Right? If this is your family, you're protecting it. So you have to protect those that you care about, and you care about your staff and your patients. So you have to know what's on social media and the news. I'm sorry if you're like me, I'm not a huge scroll through the news, read it all kind of person, because I've learned, like I said earlier, it's very opinion-based. It's meant to lead us toward a decision, and it's not always the right decision, right? But you have to know what's there so that you can protect your family. Use your CDC guidelines to determine how you're going to handle your patients. Stick with one set of guidelines. I know they're getting a really bad rap, but guess what? As healthcare providers, we get a bad rap every day where people are hearing that our rates are rising and the cost of healthcare is rising. Well, I'm going to fight that narrative, and I'm going to say, no, the cost of health insurance is rising and out-of-pocket costs are rising, right? So understand that the media is designed to scare people And it's really right now working to create a lot of confusion. So we have to find at least one stable point that we can reference for everybody. And I highly recommend that you look at the CDC guidelines as you do this, because at least that's something stable, as close to stable as we're going to get right now. Don't let the news or social media be your guide. Okay. Yes, we recognize that most people do trust and believe in what the news and social media is telling us. Okay, can't control that per se, but don't let it be your guide, because remember, you're the leader, the protector. You're the one that's helping your team. Okay. Have clinic and practice policy. This is important as well. I'll talk about that in a minute. Foster the right mindset in your staff. Okay, you can be that leader that helps them, right? You're not telling them what they believe is wrong, but you have to foster the right mindset in your practice. And you need to help them to foster the right mindset in their patients. You're having a lot of dropouts right now because our team is unsure how to handle when somebody calls and is kind of panicking a little bit about having symptoms or maybe just being exposed. And so we have to have a way to help our team also keep things calm and moving forward. So how can you protect your team and your patients? Well, first of all, don't allow negativity to take a step into your practice. We actually put this policy in place back in 2012. Okay, one of the things I've learned over the years of my own studies and education is that policy is the first form of protection. Policy should not be designed to discipline or handle someone that's already created a problem. You want policy put in place to protect the team, to protect the family. And remember, your patients consider themselves family too. Okay, so policy should be in place to protect everybody. And this is a little bit about what we did back in 2012, and we really put it in full force back in 2020, and we've reiterated it again as we've started to enter 2022. So the first thing, our staff actually wrote this part of the policy: absolutely no negative talk in the clinic. Don't bring bad attitudes into the clinic. Leave them outside the door. Right? We want a positive, healing environment. And for those of you that have a very holistic approach or have a very holistic beliefs, you know that stress, upset, frustration can increase illness and pain. So you want to keep that negative talk out of your healing environment. No outward discussion about what somebody saw in the news. Remember, that's negative talk. It creates confusion. There is a lot of design in this to create confusion. And we got to keep that out so that we can provide the care that we actually intend to provide. So don't let people bring news into the clinic. No outward COVID gossip. I don't want my team or others talking about what they heard about so-and-so or what their experience was. We all know people that have had experiences. We, unfortunately, many of us know somebody who's passed away. I understand that, but you don't want it in your clinic because that doesn't project a healing environment. Okay. You don't want TVs playing the news. Remember, the news, there's a lot of confusion. If you were here early on and you saw that first slide, you know that the news is creating some level of confusion because everything is opinion based right now. There's no just data. I'm a hugely data-driven person, and it has driven me crazy from the beginning, which is why I have to be careful watching and listening to the news, because it's just not, there's no actual data out there, right? And I'm tired of the fighting. I just want to know what to do when, okay? So we like to say, play shows like HGTV, house building, something fun and positive, or at least something that distracts the patient from the real world while they're there, if you have TVs in your clinic. The other thing you want to do is put policy in place to redirect your patients or staff. So if somebody is going down that road, let's say I'm talking to Sally and she's starting to bring up something negative or frustrating or not so good, right? It doesn't have to be COVID. It can be anything negative. Just find something else to change the subject. Oh my gosh, are you going to watch the Super Bowl coming up here in a few weeks? Hey, did you see that game the other day? Oh my gosh, did you see the rainbow going home the other night? Right? It's like an immediate, you almost gently but politely interrupt them and distract their mind to something positive and then change the subject. So this is the policy we put in our clinic. It is very effective at keeping people focused on healing, keeping them focused on that nice even keel. Now, the other thing we have to look at here is building trust with our patients. We have to let them know how you're keeping them safe. Okay, you work really hard at it, but I'm sorry, people's awareness isn't always where you want it to be. So you have to let them know what you're doing to keep them safe. You have to let them know what's happening. Now, I'm sorry, again, with all the confusion in the media and everything else, people have lost a lot of trust in others. Okay, we have to show them that they can trust us, that they are where they're supposed to be, that we can help them. Okay, so you must make them aware of how you're keeping them safe, right? You may think, well, we're really obvious about it, right? But you have to make them aware. And you should let them know from that very initial phone call, that first call, first time somebody calls to schedule an evaluation, right? Those of you that have worked with me, you know that you already have a process to follow. Add this to your process. For those of you that haven't worked with me before, it's okay. You still need something to let that patient know from the very first phone call and from the eval exactly what you're doing to keep them safe. And you should let all of your patients know starting today. So any current patient should also know what you're doing to keep them safe. The more you drive this home over and over again, the more people will trust you. They'll feel confident coming into your practice. Now, it's not just what you are letting them know that you're doing to keep them safe. You've actually got to show them that, right? So I'm not going to have, if I say I have masks, everybody has to have masks on at all times when they're in my practice and wearing them correctly. I'm not going to have staff that are wearing their mask at half mast, right? Or over their mouth and not their nose. Or I'm not going to have patients walk through the door and let them do whatever they want to do. I'm going to follow the process, even if it's a tough discussion. Now, here's a quick script you can use on the phone. All right, so Bill just scheduled an eval. I've got to let him know what we're doing to keep him safe. Okay, Bill, so now that we have you scheduled, let me share what we're doing to keep you and everyone else who enters our clinic safe as possible. And then you're going to list out what it is you're doing specifically. These things here are things that we're working to do specifically. I think it's pretty much common sense. It's pretty much what most of us are likely doing, but it's important that you have your list. Okay, different areas of the country have much more stringent requirements than other parts, so I know it's a little bit different, and that's okay. You just have to let them know what you're doing to keep them safe. Now you have to ask them, do you have any questions, right? I'm going to tell you what's going on. You have to find out if that patient has questions, because questions simply mean they don't understand something. And another cause of drop-offs is when a patient doesn't understand something. So if you create more confusion, that could be a sign of a drop-off. Okay, so you have to find out, does this patient understand what I just explained to them? Now, for your current patients, do the same thing. Have a simple letter that you can put out to them so that they can just follow along, right? So they know what you're doing. So these are the people that are currently patients, right? We have to help them to know what we're doing to keep them safe, because it might be obvious to us, but remember, you live in your company and your job, your team lives in their job for 8 hours a day if they're full-time, right? So it's very common sense to us. Unfortunately, it's not to others. And remember, if there's a lot of bad or confusing news out there, people think that nobody's following the rules, right? So I just recently moved to Florida because my husband's working down here, and there can tend to be a lot of bad data. So I went home to Virginia for Christmas, and there was a ton of bad data out there about Florida. And I was like, well, I don't see that anywhere. But there was a lot of misinformation. So we have to put real information out to our patients. This tamps down the stress, and it keeps everybody moving forward consistently. So for those of you that are on right now, if you joined a little bit late, if you put your name and your email in the chat box, I'll make sure I send these to you at the end or later today. I'm only sending it to those you want it. So if you don't want it, there's no harm, no foul, but I'll send you the copy of this recording and I'll send you those. You can just drop it in the chat box, or I'll give you my email at the end if you have questions. All right, so the other thing we need to do, we said our product and our purpose is to help people. So we have to keep everything about help. All right, so it's all about help. It's what we specialize in. This is what we do. I don't care what kind of medical provider you are. Like I said earlier, I was with vets and PTs this weekend. And guess what? We're all about help, right? It doesn't matter where you are in healthcare, you should keep your focus about help. So your goal is to help, and this is how you help. First and foremost, you can't let people drop out or disappear because of COVID issues. And I'm going to talk to you about that in a minute. It's your responsibility to get them in at the end of quarantine or isolation. Look, it's okay. We're going to follow the guidelines. We need to follow the guidelines, right? COVID in its own way is a form of like a formal act of God, right? So we have to control it, but it might still run rampant through our community. So what do we do at the end? We have to get these patients back in. It's the only way we can help them. So how do we do that? How do we get them to continue forward after whatever it is, right? After isolation, after quarantine, after symptoms, after a positive test, after exposure, how do we get them to keep coming in? Well, the first thing you have to be aware of is you have to educate your patients from the beginning and continue it all through care. Education is your key to success. Remember, obvious to us, not necessarily obvious to our patients who aren't aware of everything we do all day long or what we need from them. If they need to isolate or quarantine, tell your patients what you are going to do and what happens next. You can't rely on people to decide what's going to happen next. You have to set the path in motion, okay? Remember, the third thing is constant communication. Don't let your communication with your patients drop out. It's really easy for somebody to say to you, you know what, I'll call you when I'm better. But you can't really do that. So in order to do that, you want to make sure that as you're going through all of this, you're staying and remaining in constant communication with your patients. Now, you want to make sure you're educating everyone on your expectations, right? As a practice owner, as a practice manager, we have expectations for everyone, not just our staff, but our patients. You have to hold your patients to your expectations. You have to hold people accountable. To keep up a sense of calm, you have to educate people, right? They got to know what you're doing, why you're doing it. They got to see you doing it, but you also have to educate them on what you need from them. Sorry, people don't read your paperwork. Let's be real. You know it. I know it. This is why cancellations occur, by the way, is because people don't read your paperwork. But they also aren't going to read a letter or an email that you put out to them telling them what you're doing to keep them safe. So you need to educate them on exactly what's happening and what you need them to do. What do I do? What do you need them to do if they get sick or have symptoms? If they're exposed, you need them to define exposure for people, because remember, there's a lot of confusing data out there. What does it mean to be exposed? Did I just pass Sally Sue's cousin's friend's uncle in Walmart and I didn't even realize it was them? I didn't talk to them. We all had our masks on, but somebody calls me later and says, weren't you at Walmart the other day? So-and-so was at Walmart, right? Do you see how if there's not good data, and if you're not a stable base for your patients, they might not understand what that means. And again, we're not here to tell people what to do. We're here to be a guide so that we give the best advice and we can help keep people on. You need to define close contact, right? It's okay to have just simple CDC guidelines on what that is for all of your patients. Right? You don't have to redefine it yourself. Remember, keep this in mind as well. People need to hear things repeatedly. Remember the rule of 7. People need to hear something roughly 7 times before they fully take it in. A piece of paper is not the best option. It's a great reinforcement, but you have to have that discussion. So you need to talk about it at all times with patients, what you need, what you expect, where things are going to go, what's going to happen should one of those things occur. That keeps you all on the same page. It keeps your patients from just falling off and disappearing. You also need to reiterate it throughout care. Look, you can't just do it at the first phone call or the first visit and assume that everybody is like you and that they one time heard means one time, I know it. Okay, there are very few of us can hear something one time and remember it. Okay, the average person cannot. In fact, they need to hear it or see it 7 times. So you got to tie it into other discussions, right? As you're scheduling out the plan of care, or as your PTs are talking to their patients, or your other providers are talking to the patients. You need to keep reiterating this over and over again. Drive it home. Let them know this is what we're going to do. Now, for those of you that have been in my program, you know, right? The more you sound certain, the more people are going to listen to you. Those of you not in my program, the more you sound certain, the more people are going to listen and believe in what you say. So you have to project certainty. It can't be, oh, okay, no problem, just call us back later. It's got to be, okay, I understand. This is what we are going to do, right? You project the certainty, you lead them down your path. It's important to tell your patients what's going to happen if, whatever if is, if they get sick, if they have symptoms, if they test positive, if they're exposed, this is what will happen if, okay? So this is what we want to keep in mind. Now, if that, whatever that is above, happens, now we got to tell them this is what we're going to do next, right? So your path is what you are keeping them on. You are not going to let your patients create their own path because that will create problems for you. Okay, so since you have symptoms, this is what we're going to do. Or, okay, since you've had a close contact exposure, husband living in the house with the wife, husband sick, wife's been close contact, she's going to quarantine. Okay, so this is what we're going to do. Now, the key to your success, 1,000%, is maintaining communication. If you don't want your patients to continue to cancel or to drop off, you have to maintain communication with that patient. Again, that's the key right there. So you can't assume that somebody's going to call you. Yeah, I'll call you when I'm better. Oh, okay, no problem. You're going to be waiting a really long time. Your staff's going to be waiting a really long time. So your team must remain in contact with the patient. So if they drop off because they're sick or they need to pause care because they have symptoms or they tested positive or they're going to quarantine for exposure, your team has to stay in contact with them. They should be calling every other day to check on that patient. Yep, your team is busy. I have worked in the front office. I have sat in their chair. As I created my training, I sat at the front desk. I learned what was needed and wanted. I know how busy your team is. They should be calling that patient every other day to check on them. One, because our goal is to help people, right? So I can't help you if I don't know that you've gotten worse. If I know you've gotten worse, now I can direct you where you need to go. We are providers. We can tell patients, you need to call 911, or I will call 911 for you, right? That is part of our ability to care. Okay, it's to help people. Here's something your team needs to really, this is where they need you. Okay, it's very common with our front office because guess what? They get beaten up every day, right? They have people that get snappy at them, that yell at them, that are disrespectful to them, which they don't deserve. Okay, they get the belief that they're being intrusive because some snotty patient told them that they were being intrusive or that they were harassing them, okay? Keep your team focused on help. The purpose of these phone calls is to help your patients, okay? To stay in communication. And by the way, as providers, in order to keep everyone safe, we should be in any form of communication with a patient who tests positive or has symptoms or has been exposed, because we need to know the percentage of our patients that are dealing with this right now. And regardless of whether COVID is a year after year thing, where it disappears and the flu comes back, we really need this data moving forward. Okay, so your team can't have the feeling that they're intrusive, right? Keep them focused on the fact that we're doing this because we care. Okay, it's not about pushing the patient or harassing the patient. It's also not about the money or the numbers. Let's be real, guys. We know what our average reimbursements are, but we also know, what our overhead is. We really know the numbers, okay? It's not about money. We didn't get into healthcare about the money, and it's not about the numbers. It's not about just filling the clinic because, again, this is not a deli line or a concert venue, right? This is a provider's office. It's about helping people get the care they need and deserve. That's why we call our patients, because the minute that quarantine or isolation and that time frame ends, we need to get them back in our clinic ASAP, right? So we stay in communication so we know when there's symptoms, they're asymptomatic. So we know that fever's gone, that their cough is down, that it's been X number of days, whatever the CDC is telling us at that moment. And you have to remember, that's it always. It's always about helping people. And we have to keep our team focused. That's where you come in as an owner and a manager. That's how you lead. That's how you're the voice of reason. You keep your team focused on helping people. Look, if you don't remain in communication with your patients while they're sick or while they're just, quarantining because they were exposed, they're likely to fall off because life gets in the way and people get busy and they stop seeing the importance and the value of coming into your practice. So handle your patients, stay in communication with them. By the way, they don't get the care they need to recover. And then what happens? Whatever service you provide didn't work. And there'll be less trusting of that service down the road. Even though it was their fault in the first place because they dropped off, people don't like to admit that it's their fault. So it's going to become your fault. So instead of it becoming your fault, teach your team to handle their patients, show your patients that you care. And look, if I say to you, okay, so you've tested positive, you're asymptomatic, we're going to follow these guidelines. This is what we're going to do next. And part of that is, hey, I just want to let you know, as part of our need to keep everybody safe and know what's happening with all of our patients so that we can keep others safe, this is what we're going to do. We're going to follow up with you every other day until you're either asymptomatic or you end your quarantine or isolation. And that way, we can get you the care you need and deserve right away. Do you see how you can lead your team? Okay, cool. Don't let your team call them once. This is part of being in communication. I can't call you once and just let it go. Look, they're not being a bother. Like I said on the previous slide, they really aren't being a bother. Staff need to know they're not bothering their patients when they call, email, and text repeatedly. Remember, it's just about helping that patient get back in as soon as possible because we need to continue that care in order to reach recovery. And remember, our ultimate measurement of people helped in a medical office, especially physical therapy, is full completion with the patient achieving their goals, happy, satisfied, pain-free, living life to the fullest, and basically referring other patients. So if we aren't getting people there, we really aren't achieving our purpose. Okay, so keep your team purpose driven. Remember, that's why we're all here, to help people. And they have to see this, right? So helping as part of being their guide, as part of being their voice of reason, help your team see that calling, email, and texting is a form of help. It's staying in communication so that we can help them. It's calling them because we know that if we don't get them back in the practice, they're not going to achieve the results they're looking for. And that's really why we're here. So don't let them give up. Okay, so we need a process to manage our patients. It doesn't matter what we're talking about, whether it's a new patient, a regular same-day cancellation or no-show, or dealing with this fun process of COVID, we still need a process to manage our patients. This is how we keep problems from occurring and move patients forward the way we know they need to move forward. I didn't go to PT school and be a PT for 20 years to say it's okay for my team who doesn't want to handle somebody because they're afraid they're going to yell at them to let that patient drop off. Because as a PT, I know that the only way I can help them is to get them in the door and really provide the care that I went to school to learn how to provide. So you have to have a plan for what happens when. Your front desk needs to be able to manage your patients. If they don't have a plan, it's going to be difficult, right? So to do that, they need a program to follow, a script to use, and the confidence to handle their patients. And they need all three of those things, right? They have to know the steps to follow. They have to have a set script to use and the confidence to handle your patients so that everybody's handled the same way and everybody knows what to do if. So what's your guideline for isolation and quarantine? What are you using? Have you made it clear to your staff? Do they have a tree to follow? Do they know what to say and do? If this, do this, say this, okay? If not, they're going to make up their own, okay? And that's not because your staff is bad. They truly want to help. But if they're uncertain on this topic or any patient management topic, they're going to make up their own process, their own script, their own way of handling that. And it'll be based on possibly what they've heard from others, the news, or social media. So I'm not going to tell my team what to do, but I'm always going to be the voice of reason. So I'm going to provide a process for them to follow, a script that they can use, right? So that they do this if versus making up their own out of fear or what somebody else said. And it could be what a patient said to them, right? And that's what we don't want. We want them to feel confident. We want them to sit taller in their seats and feel good about what they do. So the other thing they need is to be comfortable managing their patients. To effectively manage their patients, your front desk has to be in control. They have to understand what that is. They have to see themselves in that role, and they have to enact it day after day after day. If they don't, they become the effect of whatever is thrown at them. And I'm sorry, but they get a lot more thrown at them than you think on an average day, especially when they're not confident and in control of their processes. So control simply means that you know exactly what should happen, when, and be able to make that happen. So I know the path my patients need to follow, no matter what that is, whether it's a new patient coming into my practice, how to handle same-day cancellations and no-shows, how to handle this fun surge in cases right now. Scripts help, right? In fact, scripts provide consistent message, right? If you have more than one PCC at your front desk, they should have scripts to follow so that everybody's putting out the same message. But also, even if you just have one PCC at your front desk, they should have scripts to follow so that everybody hears the same message. Right? So here's a simple script that we might use with a patient. Okay, so based on what you're telling me, it sounds like you're going to quarantine for the next 5 days. This is what I'm going to do. And this is where you tell them exactly what's going to happen next. Right? I'm going to call you every other day. And the reason for that is this. Number one, we need to make sure that at no point in time you become symptomatic. If you do become symptomatic, we do need to know, and that way we can help you stay safe and help the rest of our patients. You need to know why someone's canceling. Here's another big tip for your front desk. If they don't know why, they can't handle it. And there's a big difference in how I handle somebody based on positivity or symptoms, right? Because there are CDC guidelines for that. Someone was exposed. My patient calls and said I was exposed. There are guidelines for that. I might have been exposed. Okay, we might have to ask some more questions to get what we're looking for. I'm scared and I don't want to go out. Right? Look, there are people that are there right now. It breaks my heart, but we want to still stay in communication with them. So we have to have a way of handling them and not having cancellation after cancellation after cancellation from that one patient. I'm canceling for some other reason, right? Those slackers, those ones that are like, it's kind of cold here in Florida today. I really just want to stay inside and watch Netflix. I don't want to leave because I can't put on shorts and a t-shirt, right? That's an unexcused reason. Does your team know how to handle their patients in these different scenarios? Now, like I said, they have to know how to handle each scenario. If they don't have a process to follow, you're going to have a problem, right? So they need to know what happens next in any one of those situations. What do they do next? How to proceed, how to handle that patient, what to do with that patient, how to follow up with that patient, charge that patient, what to say. They got to know what to say. The better the scripting, the better the training, the better they can handle your patients, the less problems you're going to have. And they should be able to confidently and consistently do that, right? I don't want a team member to say one thing to one patient and another thing to another patient. Number one, that can be perceived as discrimination. I don't know about you, but we work really hard not to discriminate against anyone. Okay? It's not why I got into healthcare. I got into healthcare to help all people. So we want to make sure that they're confidently and consistently handling everyone based on what they're saying in a specific fashion. And you don't want them to create their own process because you may not be happy with that process. It may not be the one that you have going on up here. So your team needs an exact process to follow. Consider this. Does your team have a program to follow? And I'm not just talking about COVID program. I'm talking about a consistent cancellation and no-show program that gets results. Do they know how to handle a patient in different scenarios? How do we handle somebody we can't charge? How do we handle somebody we can? What do we do with our workers' comp patients? How do we handle those unexcused cancellations? Or that sweet little old lady that's really nice to everybody and I really like her versus that jerk that I really don't like? Do they know how to handle them? Is each team member of your team consistent in how they handle patients? Do I handle Mrs. Smith, who I happen to love, the same way as I handle Mr. X, who I really don't? Or does each patient get their own special treatment? Because that, my friends, is discrimination, and that can bite us all in the butt. Okay, and that's not why we're here. And our team isn't doing it because they're bad people, by the way. They're doing it because they don't have a set program to follow. Are they giving mixed messages, right? If I stutter, if I hem and haw, if I don't provide the exact data to everyone, I'm giving a mixed message. You're going to get a mixed response, and you're not going to like it because it will affect your arrival rate. Are all patients handled the same? It's really important that everybody's handled the exact same way. The other thing to consider is there a plan for what happens after the surge? The surge is going to go down just like it did the last few times this has happened. Is there a plan for what to happen? Are you prepared to handle those unexcused same-day cancellations and no-shows? Because once this surge is over, your team is still going to struggle with that. And I'm going to tell you why. Okay. If you want this information, you have two options right now. I just want to share with you. You can send me an email at d@frontofficeguru.com, or you can just throw your name and your email in the chat box right now for those of you that are on. And that way I will gladly send you this information. Okay. All right. So moving forward, the better you train your front desk, look, the more successful your practice. For those that are on here that have worked with me, they will flat out tell you their success comes by training their front desk. It's not the end all be all. I recognize that. I've created training across my entire practice, but your front desk is the first, middle, and last point of contact for every single patient that comes through your practice. They're the ones that your patients feel really comfortable saying that they don't like their provider, or that this is happening or that is happening. All right. So the better trained they are, they're not just a friend to the patient, they actually can handle the patient. Now, if you're struggling with same-day cancellations and no-shows right now, right, you're suffering with this stuff. COVID is just smacking you down, or the bad weather is smacking you down. Well, guess what? You're still going to be suffering with them when this surge is over, and this is why. One, your team is used to letting people slide. They've lost their juju. They've lost that drive to get people in the office. Maybe because they've just been beaten down. Maybe because there's lots of confusion. I can't tell you the reason why, but I can tell you it's very real that it does happen. They don't have what they need to handle people, right? If they don't have a set process for what to do, if not just COVID related, but in general, that will affect your team, especially for those of you that have had turnover or a lot of turnover in this past year. Don't rely on your team to know how to handle certain situations. Without a set process to follow, it's scary to challenge someone when they call for an unexcused reason. How do I handle them? Or for the fourth time, they're sick, right? That can't happen because that creates a big hole in your schedule and you can't help somebody else. Or when someone gets rude or ugly, right? That knocks your team backwards, and they have to have a process so that they don't feel knocked down even when that happens. Especially when it's time to charge that fee. If there's not a process in place and they're charging it at different times for different people, or they're not sure, they're going to get smacked by a patient. Maybe not literally, but figuratively for sure. And you all know what it feels like. If somebody yells at you, it does feel like you've been smacked, right? So you've got to be aware that your team needs to know. They need to be trained. They need to know how to handle it. So you might be wondering, well, how do I do this? Well, look, this is what I do. Or how do I know this? Well, I spend my days training front office staff. Cancellations and no-shows are what create front office training in the first place. Because, well, back in 2012, I took over the administrative side of our practice. I stopped treating and I started focusing on helping Mike expand. And one of the things I noticed was that my front office was weary of challenging people. They didn't like it. It was not fun. It was super uncomfortable. Heck, it might be uncomfortable for you. They didn't have what they needed to stop same-day cancellations and no-shows. And you can stop them without being a jerk, without being rude. For my staff, challenging them, and maybe for your staff too, especially newer staff, right? Handling somebody can be scary. I don't want to tell another adult what to do. In fact, and maybe this is real to you, our arrival rate back in 2012 was 75%, which meant that 25% of our patients weren't getting in for care. That was super frustrating to me as a PT. Now I want to show you what the average practice loses just by same-day cancellations and no-shows, and I want to show you the change that you can make. A practice with an 85% arrival rate. So if this is real to you right now, maybe it's even lower than that. That means 15% of your patients every day are canceling or no-showing on the day of service. Let's say this practice is doing roughly 167 visits a week. So that's the average size practice in many cases. If your reimbursement was $50 a visit, the average loss per year at an 85% arrival rate and 167 visits a week is $76,000. Guys, that's a new grad PT. If your reimbursement is $75 a visit, your average loss per year is $115,000. And at $100 reimbursement on average, it's $153,000. That's 2 PTs. It could be more patient care coordinators. Heck, as an owner, that could actually be the owner's take home, because we know that we sacrifice for our team because they're our family. Now, I want you to consider if you were able to increase your arrival rate to 95%, and it is doable, right? If you follow a process, you can increase your arrival rate to 95% consistently. That practice that was doing $50 average reimbursement can increase their revenue by $53,000 that year. $75 reimbursement, you're going to increase it by $81,000. That's a little bit more experienced PT, or maybe it's a patient care coordinator and more supplies or expansion of your practice. At $100 average increase, it's $108,000 in revenue that you're going to get in your practice. Now, I don't know about you, but that was really important to me, because look, what I want you to really look at right here, you may not think that's a lot of money, but that's without doing anything else. You are expanding your practice with the patients you currently have. You are not expanding your practice. You're not having to reach for more or get more new patients or drive in more evals. These are people that need your help right now, right? So if you increase your arrival rate to 95%, you are helping more people, which is really why we're here. But you can get a return without having to put more money out to drive in more new patients, right? You can keep the patients you have and get them compliant. Now, I'm not sure if that's something you're looking for, but I know for me, it was a big one. And it was my first step in really getting my team to be in control of this process. And by the way, we've maintained a 95% arrival rate almost completely through COVID, save for that first week when everybody freaked out all in one day. We've maintained that. Yeah, we had to make changes. We had to make edits. We had to help our team. We had to put in these guidelines here for COVID surges, but we have been able to maintain it. And that's exactly what I do for practices. So you can lower your same-day cancellation no-shows and increase revenue without having to do more, meaning without having to drive in more new patients, without having to make any other major changes. And yes, we can handle across your entire practice or across your entire front desk, but this is a great place to start. So you might wonder, what can you do about it? Well, the first thing you should do is provide a system for them to follow. And I'm offering right now something I really have never done before, and most of my clients will tell you that, an 8-week cancellation prevention course. It starts next week. It runs for 8 weeks, and it's small group based to help you reduce the cost. So you can consider it a mastermind for your front office team, okay? And anybody can join. It doesn't just have to be you. It doesn't have to be just one PCC. I'm offering you lots of opportunity, and I will tell you it contains everything that I use in my practice to maintain 95% or better arrival rate, because I don't have competition. I would gladly do this with the practice that's less than a mile away from us. Why? Because there's plenty of people to go around. We're here to help people. And that's what I want for you, to maximize your ability to help people. Now, look, it's not for everybody. I get it. So who is it for? It's for you if you see your team struggling to handle people right now, because I promise they will still continue to have trouble handling people because things have fallen out. If you're sick of same-day cancellations and no-shows, this is certainly for you. If you don't care about them, that's okay. That's your choice. But it is really for those of you that this is driving you nuts. If you want a system in place for when this ends, something that you can use now and into the future, regardless of whether your team turns over 112 times. Okay, it's the front desk turns over. So what? You have something. That's what you want. Something they can literally sit down, read, drill with you, put those scripts in place, and just use it time and time again. If you see value in training your front office team, and this is for people that have worked with me before as well, I have plenty of people that have decided to join this that have actually worked with me before. They're like, oh, I've had some turnover. My team's gotten knocked down. I'm just going to do this again because they see the value. You're willing to train your team and put in the work. Look, if you think I'm a magician, I'm not. I'd be a billionaire if I was. You have to do the work. You have to make sure that your team studies and trains and actually does this. And I will tell you, this is new for front office team members, meaning nobody's ever forced them to sit down and really study and implement before. And you want them to be successful, not just do it. So it's for you if you're willing to put in the work. You recognize that teams come and go, but systems are for life. Now, let me be clear. I can sell my practice for more than 1.5 times its value, which is very rare in today's day and age. And the reason for that is the systems that we put in it. If you're somebody who's considering selling your practice at any time now or in the future, the more systems that you can put in place that prove that you get good stats time and again, you actually increase the value of your practice. I can refer you to the group that taught me that. So what do you get? If you're still on here, you might want to know what you get. You get my exact program. I don't hide anything from you. I want you to be successful. Your success is mine, just like if you were one of my patients. You get a course back. You can consider it your training manual, right? It's good for now and into the future. You can download it, print it, put it on a shelf in your practice, pull it down anytime your stats drop. You get scripts, right? My scripts work, and they work because they're not designed to tell somebody what to do. They're designed to help your PCCs be the guide for the patient and get results and really get the patient reaching and in agreement with you. And you get audio files to listen to because I firmly believe that things can be taken out of context on paper that can certainly be listened to and heard. So you get that. You get 7 group sessions on Zoom. So it's going to be group. So it's a mastermind group. The good thing is your team can choose the times that work for them. There's 3 times during the week so that your desk doesn't go empty. And you also get one-on-one coaching call at the end. So I'm here to work with you at the end. You also, like I said, you get 3 times to choose from. That way the desk doesn't go empty. If you have multiple PCCs, you can put them on at different times. They can study at different times before each call. And you get access to me on Boxer, which is a rare thing. My online academy does not offer that. It's only for those that work with me. So that way, if you have questions or concerns in between sessions, you can send me a quick message and I'll always answer you back. So how do you get started? Well, it's pretty easy. If you did it privately, it would run you about $4,500. Now you're welcome to reach out. I'm happy to just work with you one-on-one and kick your butt. But for this group program, it's 3 monthly payments of $479. So you can quickly join up, you get started today, have your course packed by tonight, get your team studying tomorrow, get on the first call next week. And I promise you the first call is fun. They will have a good time. And it's very affordable. So all you need to do is just go to frontofficeguru.com, go to training options, group cancellation program, and sign up today. If you sign up by midnight today, you get a special bonus. You get $500 off my online academy. So when you're finished with this, if you decide that you don't just want a system for cancellations, you want something to train your team now and into the future, you get $500 off access to that academy. And it's good for whenever you want to join. So you can get this in place and then join down the road. All right, so I'm going to leave that screen up because I want to give you that option to look at it, but I am going to see if I can, I'm going to pause this here and I'm going to answer questions. So whatever questions